Same thing, drop that shoulder. All right, let that roll, same thing. Nice, face up. Hey guys, Dr. Mike here, Oak Brook Medical Group in Oak Brook, Illinois, and I am here with Greg, great patient. We just laughed the whole time he's here, talk about his sports. But anyways, he is in here for low back pain. He's actually gone through care plan, did the rehab, did the trigger points. Today what we want to do is show you guys here at Oak Brook Medical Group what service he continues to do to make sure that he stays out of pain long term, right? Because it's one thing to get a patient better. Never like it to have that patient come back in a couple months and be like, hey, look, same thing, I'm dealing with it again. So we want to make sure that we keep those patients feeling great, moving forward, teach them things that they have to do at home to make sure that they stay pain-free. So for right now, what I'm gonna do is show you guys exactly how I adjust Greg and how we do that flexion and distraction to really open up and stretch that low back pain that he was dealing with when he first started. Ready, sir?
Absolutely.
Let's do it. Face down, please. This is usually the point where we'll start talking about how are the Bears doing, how was last week's game, are they actually moving to Arlington Heights, are they not? Lots of sports talk that goes on here. But objective one, always make sure that Greg is feeling better when he walks out the door. So gonna start with some flexion and distraction, really work on that low back, opening up those disc spaces in that lumbar spine. And this is one of those things that patients, 99.9% of the patients come through and say that this is the best low back stretch they've ever felt. So all I'm doing here with my left hand is we're starting to work up the vertebrae. We're just blocking them so that they don't move as I bring those legs down into flexion, and we're just creating a really good stretch in that lumbar spine. And just get a couple pumps at each level here. How we doing down there, Greg?
I am in the 99.9%.
He is in the 99.9%. I like it. Good. And now same thing. So we're going to drop and flex, but we're actually going to bring those legs right and left. Working our way up that back again. So this is, when Greg comes in, this is one of the things that we make sure we always work on with him too. So as you guys are watching this video, you'll see the clips, he comes in, he's gonna get his warm-ups in, start to loosen up the muscles, loosen up that low back. He's always gonna get stretched out and make sure we do what's called PNF, proprioceptive neuromuscular facilitation. Say that 5 times fast. To really get a stretch into those hamstrings and into that piriformis. And then he's gonna see Jose, the clinical massage therapist that we have here at Oak Brook Medical Group. He's gonna get work done, relax, and then he will see Liz, a nurse practitioner, for trigger point injection, just to really make sure we calm everything down so that he'll be good in between his visits. All right. We'll wait for technology. All right, sir, face me please on your side. All right, so now doing what's called side posture. So we're gonna adjust this low back. You get to see how flexible Greg actually is. There we go, I moved before we even did it. Good work. So far you're passing. Only on the first question, but you're doing great. All right, let that roll, same thing. Nice, face up for me, please. All right, so then going into that mid-back, so through thoracic spine here. And back, little drop. Noisy today. Very nice, good. And then last but not least, working on that cervical spine. So up here in the neck, really light with them. Drop. Not too bad. Same thing. Drop that shoulder. There it was. Stay right there. I always like to make Greg a little bit taller before he leaves. So open up those hips. A little bit of ankle on that guy too. There you go. Come on up. That way. And then finishing up those shoulders. Good. Survived another one. How we do?
Fantastic. See you in 2 weeks.
Right? Perfect. So, if you guys are experiencing any low back pain, sciatic pain like Greg was experiencing, or you even have any questions about the services you're seeing here in these videos, give us a call at the number below. If you're watching on YouTube, hit that notification bell, like, follow the page, Facebook and Instagram, like and follow, and we'll catch you guys on the next video.